evidence that has been collected over the past 30 to 40 years has looked at exercise benefits. So physical activity is all-encompassing. That includes taking your groceries from your car and taking them up to your kitchen, cutting up your vegetables, doing things like that. Exercise is the planned physical activity. So I'm going to go to the gym on Tuesday at 1 p.m. with my friend, and we're going to be there for 30 minutes. That's your exercise. Both are very important. We're going to encourage you to increase your physical activity in general, and exercise is included in that. Okay? So we use the terms interchangeably, but now you have a little bit of an idea. So research has been done pre-treatment. We know that if people are at an increased fitness level before they start treatment, they will do better throughout their treatments. Okay, their body composition is at a healthy ratio between their muscle mass and their fat mass, and they will do better. There's been lots of research during treatment and post-treatment, and the big focus and shift now has been into survivorship care, because people are living longer with cancers, because fabulous research and our physicians are doing such a good job at helping people to live longer with their cancers. So we need to focus on helping people to live with a really strong quality of life. And a few of the survivors touched on this today. They had finished their treatment and the medical team says, okay, you're done, okay, now go live your life. And they feel like, it just hit me. How am I supposed to heal? How am I supposed to focus on getting better? And lots of this care, this complementary care and exercise is helping survivors to get that energy back, manage some of those symptoms and side effects that may be lasting longer, like fatigue, so that they feel that they have control over their health and well-being again. Okay? And then palliative care, there have been some studies done in palliative care as well. So, again, I'm going to present on general findings from all different tumor groups. Just because there hasn't been a specific study with kidney cancer and exercise doesn't mean it doesn't apply. There just isn't the research yet. Probably a lot of this information is very transferable. So we know, like I've already mentioned, that physical activity and being at an increased fitness level helps to improve the initiation of difficult your health status before the initiation of difficult treatments. We also know that it helps with managing treatment-related symptoms and side effects. So fatigue is the number one reported symptom and side effect. And this, for support people in the room, my father had multiple myeloma and prostate cancer. So as a little girl, I grew up with when he was very sick and experienced what that fatigue feels like. And sometimes looking at the person that you love or in your family or your friend, you don't understand that overwhelming fatigue. It's not like you've stayed up all night. It's a different type of fatigue, he used to explain to me. So helping to manage that fatigue is very important. And we found with physical activity, intervening before treatments even start or early on helps to nip it in the bud early so you don't dip right low into that serious fatigue where it gets unmanageable. You can start to manage it early. And it's a vicious cycle, because if you get too tired, the last thing you want to do is get up and go for a walk, right? So you have to work at it early. And then you can see that we've found physical activity helps nausea, different sleep difficulties, blood pressure and hospitalization time we've also found. We also know Dr. Kerry Cornier is one of the leading researchers in this area. He's published more than 400 times. He's in Edmonton, nice and close to us. So Dr. Koulos-Reed works very closely, and us in our lab work very closely with him. And they were doing a study on breast cancer patients who increased their activity to moderate. So we're exercising 3 times a week for about 30 minutes at a moderate intensity. And they were looking at a number of different factors, and one of the things they found is that these patients were able to complete their treatment as planned, much better than those who were just doing usual care without physical activity intervention. And that's huge, because if people can stick to their treatment plan, they do much better overall than those who have to come off treatments or change around in their treatments. There's one lady that's in our lab doing her postdoc, and she's looking at childhood cancers and immunity. So we know that physical activity helps to boost those fighter cells in our body and helps to ward off infection, which can be an issue. Now the big thing, and I always focus on this because when I get up here, people look at me like I might be Jillian from The Biggest Loser. Everyone asks me, oh, are you going to make me run a marathon or lift up all these heavy weights? And it's very important to know that our focus is on physical functioning. So I'm not here to try and help you get beautiful biceps for the beach. I'm here to help you lift your groceries up onto the table, go to the soccer game that you usually like to go to with your friends, go for hikes with your partner or your kids, because that's what you like to do. And you may notice that throughout your treatments and after treatment, it's harder for you to do those things. So our research is focusing on helping you do the things that you still want to do and keeping your body as healthy as possible. Okay, so that includes physical functioning, cardiovascular fitness, your muscular strength and endurance, and your joint mobility, and then body composition, which is huge. And we really see that depending on your cancer type and your treatment type, body composition can be changed a lot. So with the brain tumor population that I work with, they're put on a certain type of glucocorticoid medication that I've seen people in a month gain 40 pounds. And you know, it wasn't up to them. They didn't try to gain 40 pounds. And then I'm working with head and neck group, and they lose mass amounts of weight and muscle mass throughout their treatments. So helping people to keep a healthy body composition is really important. The latest survival research, which is very exciting, done in breast and colon cancers, have shown that increasing your physical activity to a moderate rate, which we're all capable of, help to reduce the risk of cancer recurrence by up to 40%. There is no drug on the market right now when you've finished your treatments that can do this. And you know what the fantastic part is? It didn't even matter what they did before they were diagnosed. What mattered was once they were diagnosed, if they increased their fitness level, they could see these changes. So just that alone, if I said that one piece of information to you alone, you should all be inspired to be active now, because that was a really significant finding. I'm an exercise investigator for a new trial that's just opened up across Canada and into Australia. It's called the Challenge Trial for colorectal patients. Because this evidence was so convincing, they're now doing a big clinical trial looking at exercise intervention. These people increase their exercise for 3 years, and then we're going to follow them till end of life and hopefully see that it helps to reduce risk of cancer recurrence and helps to reduce the risk of cancer mortality and all-cause mortality. Okay. Now, that's the physical side, okay, so you're making these changes. I was just reading a study last week looking at cognition and your brain and how physical activity can help prevent your brain from shrinking. Really interesting. So, you know, not just those beautiful biceps and muscles, but actually making changes in your body with this exercise. Now, psychological is the other part, and I think this is very important because those extending your years is fabulous, but we have to make sure they're full of quality, not just quantity. So you already know this. I don't need to present this slide, because when you go for a walk, or when you go to the gym, or when you go for a hike, you feel good when you're done, right? I have yet to find someone who says, oh, I just feel awful when I'm done. Usually you feel like you have lots of energy. And so what we found is just that. So it helps to reduce perceived stress, anxiety, and depression, which are very prevalent after you've been diagnosed with cancer. And what's interesting is we see this in the support person as well. And like we know, the support person, like Brian talked about earlier, deals with a lot of the emotional burden, or huge amounts of emotional burden as well. So bring the support person along to the Wellspring class next week, okay? It's very important for both of you. We also find improved body image, self-esteem, coping skills, okay, and quality of life. And quality of life encompasses your physical functioning, like I've talked about, your psychological functioning, your role functioning in your family or your workplace, and your social functioning. Very important aspects. So I wanted to draw it in and make it applicable to you. Like I mentioned, there's no specific kidney cancer and physical activity studies yet, although there's, in some of the mass physical activity studies, there are kidney cancer patients involved in those general studies. But there hasn't been a trial that just looks specifically at kidney cancer and physical activity, although many of these general studies apply. We do know that obesity or other lifestyle factors can be risks for certain types of cancers, including breast and including kidney cancers. And physical activity helps to maintain weight management, which is important. And like when a few lectures ago in complementary medicine, we touched on the importance of cancer prevention using these lifestyle modifications, but also preventing recurrence, okay, or other cancers. So decreasing body mass may actually decrease the risk of cancer recurrence, like I just mentioned. Okay, so you know the evidence, and hopefully you feel inspired, so let's talk about practical tips how to get moving. I'm still waiting for them to make suit jackets that are flexible, because I'm going to start moving now in my arms. I should come with my gym gear next time. So I'm going to start off with this cartoon, because I think it's very true for everybody here. My whole routine lasts an hour and a half. 15 minutes of cardio, 15 minutes of weights, and an hour of talking myself into it. Right? Can we all identify? I know I can some days. So your first steps towards making any lifestyle change, including physical activity, is motivation. Where does your motivation come from? Is it the evidence that you just learned? Is it your spouse or your partner sitting next to you giving you a little nudge right now saying, you know, we really should start being more active? Is it your kids who you want to be here for many more years with them? So find your motivation, because you will not be successful at making a change unless you're motivated to do it. The next thing is setting goals. So what are you going to do and how are you going to do it? We all, you know, it's New Year's resolution time a few months ago, and you think, oh, I'm going to exercise more, I'm going to start eating right. But if you don't have a plan, it's very unlikely it will actually happen. So I'm going to go to Loren's exercise class at Wellspring next Monday at 6:30 p.m. And if I'm not sure where Wellspring is, I'll come ask her. So, or go to the booth over there, right? So what you're going to do and how you're going to do it, okay? All movement is beneficial. So people come up to me and say, you know, I don't know, I haven't been active my entire life, and I don't think I can take on a big exercise routine working out 5 days a week, and I don't think that's appropriate either. So maybe you're going to start walking twice a week for 20 minutes. And maybe if 20 minutes is too much, you're going to start with 10 minutes in the morning and 10 minutes in the afternoon. And once you feel like you can get into a pattern and you're able to do it, then maybe we'll talk about 3 days. Okay, so that's what's manageable. All movement's beneficial. So parking farther away and going for a little walk when it's nice outside. Active commercials, the TV's on, and instead of just sitting there on the couch, maybe you're going to get up and down from the couch 10 times when it's a commercial. Maybe you're going to do some stretches, okay? You laugh, but I do this. I'm serious. And social support is huge. So most of you are here today with somebody who's been supporting you, or you have someone at home or friends and family. We know that if you have encouragement to follow through with your goals, you will be more likely to adhere, much more likely to adhere. And you know what's fabulous? It's really good and healthy for the support person as well. So get someone to plan, and this isn't just for cancer survivors. I use this tool. I have a friend that I meet with at yoga class every Sunday morning, and sometimes if I feel I don't feel like it, I know that she's going to keep me accountable. On Sunday morning, I better be there, or I'm going to hear it. Okay? So make sure that you have that social support. Maybe it's a dog that you need to, you have to walk your dog every day, and that's helpful. It's also very important to be realistic about your barriers. So if you're going through treatment right now and you're finding it difficult, or you're on some certain medications that have some certain side effects, sometimes you're not going to feel like you're able to be active that day. So I work with a woman who's very inspiring, and she comes to my exercise classes every Monday and Wednesday, and she comes to our Thrive Gym, which I'll tell you about, our free fitness center for cancer survivors. And she said when she was diagnosed with breast cancer, that day she made a decision. She was overweight at the time, and she had a type of cancer that was affected by her lifestyle choices, or could be affected by her lifestyle choices. And she thought, from this day forward, I'm going to be active. She said sometimes she would walk around the block, and sometimes she'd only make it around her kitchen table. But every day she would move. She's now lost 98 pounds. She comes to exercise class every week, and she said, having the diagnosis was one of the best wake-up calls for her, and she and her whole family are active now and living much better. Lastly, what do you enjoy and what's accessible? So if you don't like to walk, don't walk. Maybe you should swim, or maybe you should come to a guided exercise class, okay? So make sure that you're choosing what's accessible to you and what you actually like. Now, the current recommendations from the Canadian Cancer Society are to engage in at least 30 to 45 minutes of moderate activity most days of the week. Now, this is very vague and very different for everybody in this room. So you have to take it with a grain of salt. This may be true for you, and maybe you're going to work up to something like this. So some first steps in getting active. Try to incorporate 3 different types of activity into your life. Aerobic, which is your cardiovascular activity, that's your cardio, right? So you're biking, you're walking, you're cycling, you're jogging, you're hiking, anything like that, that's your aerobic activity, okay? Fantastic for your heart and lungs, for your whole body, helping to manage weight, very good. And manage fatigue. Resistance and strength training. So that's, you don't need to have weights, that's moving your muscles against a resistance. Now, last time I gave this, I was giving a talk similar to this on Tuesday night, and I did a demonstration and the table like flew away from me, almost, was on the floor. But an example, I don't need to use weights, but I'm going to do a push-up, so hopefully this doesn't move. Is this going to move? So if I use my body weight, I can do a push-up using my body weight. Oh, thank you. So there we go. So I didn't need to use, I can do that at home, I can do it, against my car before I hop, you can do that anywhere. So there's no excuses. You could use resistance bands, you could use weights, or you could use your own body weight like I just showed. And then flexibility, which is really important. So some tumor groups, this is a really big important thing that we stress. So with head and neck group, when they've had a lot of radiation and surgery to their neck, working on motion and flexibility and range of motion is really important. So for you it may be a bit different, but all of us should be working on flexibility in our lives. Flexibility, make sure that you're warmed up, so you've gone for a walk or you've just hopped out of the shower or the bath and your muscles are nice and warm. And then intensity. So lots of these changes that we've seen aren't just from a little stroll down the block, although that's fantastic and I encourage you to do that. Where we see the changes is when people are moderately active. So going for a walk at a moderate pace, which is going to be different for everybody, looks like this. So you're moving your arms, and I should have a mic for it. So, and you're noticing that you're starting to perspire a little bit. Maybe you're noticing your conversation is starting to get a little bit harder to have with your friends or family if you're walking with them. So you're getting your heart rate up. You're starting to feel your heart rate pumping. Okay, so that's where you're going to notice the benefits. Doesn't mean that you need to do that for a full 30 minutes. Try starting off with doing that for 5 minutes, getting your heart rate up a little bit. So if you're looking at this scale, and 0 is before your alarm goes off in the morning, and 10, I'm calling the ambulance because you've never worked so hard in your life, we want to start around a 2 or a 3. And then we can work up from there. Okay, so it's going to be different from everybody. An elite athlete, a 2 or a 3 may be really hard for you. So you need to kind of judge this scale, and you can come back to this and think, okay, where am I right now? Do I feel like the alarm just went off and I'm still in bed, or do I feel like I'm moving a little bit? Maybe I'm going for a walk and it's light, a number 2. So work at 2 or 3 and then work up from there. I'm going to touch on those 3 different groups that I talked about. So aerobic exercise. So I've already touched on this, activities that use your large muscle groups, so your legs, your core, your torso, and your arms. They're rhythmic in nature. So cycling, for example, rhythmic in nature, works your heart and lungs due to higher oxygen intake. The benefits. So this is what they've found in literature reviews. We found it helps to reduce fatigue, okay? Helps with symptom management, like I already talked about. Improves your cardiovascular fitness, your heart and your lungs. For some cancer types, they're put on chemotherapies that are quite cardiotoxic, so it actually affects the epithelial linings of your cardiovascular system and your bloodstream, and it actually, it's hard on your heart and your cardiovascular system. So in the future, they may have more issues with heart disease. So helping to have a strong heart and lungs is very important. Improving your quality of life, which is the key, right? We want to have a good quality of life, mood, and decreases anxiety, depression, and stress. So recommendations. Again, this is very, very variable. 3 to 6 times per week, okay? If it needs to be 2 at the beginning because you're thinking I can't even do 3, that's too much, that's fine. Intensity, about 40 to 50%. So that's that moderate intensity I was talking about. And then you can work up from there. 20 to 60 minutes. Again, here's your range, so it's very dependent on your own body. You want to feel like you've challenged yourself. So if you go for a 20-minute walk and it was a cinch, you could go for another 3 hours, maybe you should up the intensity a little bit, okay? And type, any type you like, okay? And I've already talked about those points on the bottom. Resistance training. So I already gave you my demo. I'm not going to get down on the floor and do another push-up. But this is when your body's working against a resistance. So it's designed to build lean muscle. So lean muscle in our body is very, very important. Lean muscle is correlated to and predicts our metabolic rate. Lean muscle uses a lot of energy, whereas fat mass doesn't, although it takes our heart a lot of energy to maintain that fat mass. So that lean muscle helps to increase your metabolism and increase your fitness level. If we go through treatments and our muscle is wasting, when we're finished, our metabolism will be lower, we will have less lean muscle, and that puts us at more risk in the long term. Okay, so this is very important to do your strength training. Strength training helps to reduce fatigue, increase your muscular strength and endurance. So you may notice that after treatment, you couldn't go up the stairs like you used to because your legs get very sore and start burning at the top. Okay, so this helps to work towards reconditioning yourself. With your physical functioning, like I've talked about, body composition, and this is where we see that improved treatment completion rates. So start with 1 or 2 times a week. Your goal is to get towards 2 or 3 times a week. 2 is a good number. Okay? You don't have to do this for very long. Maybe you're going to work a few big muscle groups and you're going to do a few exercises maybe for 20 minutes for that day. Okay? Work on 1 set to start with 12 repetitions. So this is 1 set of 12. 1, 2, and then I go 11, 12. So I go all the way up to my 12. That's 1 set of 12. By the end of the 12, you should feel like you can't go to 15 or 16. That's how you know how much weight to choose. If you could go on forever, you need to pick up a bigger weight so that you're actually challenging your body. If you only get to 2, you need to put down that weight and not hurt yourself and then pick up a lighter one, okay? And then taking rest in between if you're going to do more sets. Okay. Flexibility training. So gentle stretching movements, very important. So we don't do the Jane Fonda, stick your leg up and start yanking towards your leg anymore. We don't do that because your muscle is very smart, and if you yank on a muscle, it will retract back on itself. They're called Golgi tendon bodies in our muscles. So we gently stretch down into our muscles, okay? So, benefits of flexibility training: increasing your range of motion in your joints, lengthening your muscle. If you lengthen your muscle, so there's more muscle fibers along, you have much greater potential for strength because you have your strength by contracting all those muscle fibers. Improving your posture and your circulation. This is big, the posture one. Injury prevention, maintaining freedom of movement, especially as we age, because we already face this, and improving quality of life. So flexibility, I'm just going to say we want to work on having flexibility most days of the week, okay? And again, making sure that you're warmed up, okay? So gentle, slow stretching, warm muscles. Now, making it a part of your life. I usually, when I'm talking to a small group, I'll pass out calendars, and I found this fantastic magnetic tape, so you can tape it right onto your fridge so there's no excuses. And you can actually trigger yourself. So writing down, okay, on Monday I'm going to Loren's Wellspring exercise class. I'm really beating this into you today, so that you have a cue to encourage you. So I use this in the morning. I put my running shoes by my bed, and when I hop up and I think, oh, right, I have to go for my run this morning. So lots of us use cues to help us adhere to a program. You can also use this as a recording device. Very important. People who use techniques like this are much more likely to adhere to a physical activity program. I'm going to skip over safety precautions just because I'm running out of time, but obviously very important. Talk to your physician. Make sure that when you're working with someone with physical activity that they have the credentials behind their name and that they are certified to work with cancer patients. So the problem with our industry right now is somebody can take a weekend course and call themselves a personal trainer, or they can do an entire degree and do extra certifications in cancer and exercise and do their master's or their PhD in cancer and exercise and call themselves a personal trainer. So it's very important for everybody in the room to check out who you're working with. Okay? And making sure that you're safe before you start to exercise. So the last thing I'm going to touch on today is the Thrive program, which we have at the U of C. Dr. Koulos-Reed really believes in knowledge translation, so doing this research but then implementing it into community programming. Somebody already mentioned the benefits of yoga, and Dr. Koulos-Reed actually started looking at the benefits of yoga about 8 or 9 years ago, and now Yoga Thrive is throughout Calgary, throughout Canada, and at some sites in the States as well. So it's a 7-week program that all of you can participate in, and maybe some of you have participated in it. So we do education classes. We talk at a number of events. We have the Exercising for Your Life at the Tom Baker, the first Wednesday of every month in the Tom Baker Auditorium. It's an hour-and-a-half lecture, free for you. And then other talks upon request. We have the Yoga Thrive program, which is a 7-week program available to you. We have the Thrive Lab, which was started last summer based on a few research studies doing lactate testing in cancer patients, and we actually have exercise physiologists who will test you and prescribe a program for you, okay? And then we have the Thrive Center, which we just opened, which is a fantastic exercise center at the U of C right by the Olympic Oval, and it's free. And we've trained 20 undergraduate and graduate kinesiology students who monitor the space, and you can come in and use the equipment. Okay, and you have that information in your brochure. And then free exercise classes at Wellspring on Monday and Wednesday evenings. If you're interested, you can call Wellspring and you can drop in. I have people who have just started treatment, who have been in treatment for a long time, and who are 20-year survivors. And it's a group format, but we individualize it, and I get to know you, so you're all welcome at dropping in, and so are support people. So take-home messages today. Exercise is an excellent way to improve your quality of life into cancer survivorship. You have complete control over whether you're going to increase your physical activity or not. There's nobody that can take that away from you, even if it's little bits of movement. Start slowly and move gradually, and seek supportive and safe programming. Okay, so check into the credentials or come and participate in the Thrive program. Focus on what you need and set goals for yourself and have fun with it, because it's a wonderful thing that I hope you will all enjoy or already do.